With us today, a very special friend, Dr. Mary Sanchez. Dr. Mary, thank you for being here.
Thank
And
you, Suzanne.
would you just tell us a little bit about the history and why we're doing this video specifically for National Doctors Day?
Well, it is National Physicians Day, which actually has grown into National Physicians Week, which this year was March 25th through the 31st.
Man, was that timely or what? That worked out.
Incredible. I work with many physician organizations at the state and national level, and one of them is called Physicians Working Together. It's a grassroots organization started in 2015 by a good friend who basically has gotten together medical students, residents, and has expanded one day to 1 week, and it's been a real blessing. And so, but today on National Physicians Day, the timing couldn't be any better for a group of people who are out there every day in the front lines of this pandemic, risking their lives and working long hours to ensure that the public is cared for. Sometimes under pretty difficult circumstances because we're just not ready for it yet. And so, so it's important to not only celebrate, but also ensure that physicians, nurses, all first responders, all medical professionals have everything they need to care for patients safely. And that begins with their own personal protective equipment, which we can talk about.
Well, let's go ahead and talk about that, because that seems to be the top priority is how can we who are quarantined, how can we help? What can we do?
Right. And there is a lot that can be done. And I would like for it to start right there.
That's great.
So personal protective equipment, or PPE, is what keeps people safe when they're caring for others who may have something that is contagious, an infection. And so it's the first line of defense in terms of infection control when you meet someone. So what we need right now in hospitals and offices across the country, and certainly in Florida, is to have enough N95 masks. And that is the mask that has a special filter that actually traps particles and helps when, in particular, when you go into a room where you're certain that somebody has the virus. And then there's surgical masks, which are the masks that, you wear when you're not certain. But it is still a high risk situation. And then we need gloves, and we need disposable gowns, and we need face shields even. So to have all the proper equipment, it would be all that. And it is needed everywhere right now.
What can we do? How can we get that? How can we help with a supply of that?
Thank you for that question. And so, so the first thing is, one very simple thing that I'm asking people to do is to call your individual physician's office and ask, do you have an N95 mask? And everyone in your office, do they have one? And then what do you need? What might you need? And actually, that might be a simple way. I actually have a physician friend in Daytona Beach who a patient brought him an N95 mask, which I just was incredible to me.
No kidding.
Right? And I found that out this week because I've been getting in touch with basically all my physician friends to ensure that they have what they need. But so patients can start with that. But also just having drives in different local areas, in communities where they're just gathering the supplies and then distributing it to. And I want to make sure that not only hospitals, because many of the hospitals do have the ability to order in bulk and have the financial means to do so. But many of the physicians that are out there on their own are the ones that I think can be sometimes forgotten. For example. The legislature is sending 1 million masks to the Central Florida region. I heard because I've been in touch with my senators' aides and their office. And so I know that that's happening, but it's going to be distributed through the health departments first and through different public health settings. And so those individual doctors or small practices that may not be as connected with that chain may be forgotten. So I want to make sure they are not forgotten. So those are some things that can be done. The other thing that's happening is some of the county medical societies have come together and are doing drives to gather more PPE or personal protective equipment. And so that's something else where, people can contact the county medical societies and inquire and ask. And if they haven't thought about doing that, maybe they can do that as well. So have a gathering will help.
Have a voice. Speak up.
Absolutely.
Ask questions.
Absolutely.
Make phone calls.
Exactly. And, and also for physicians and nurses and medical professionals of all types, respiratory therapies, the people who are, at the front lines, so important right now to speak up and to, let their voice be heard. This is not a time to take risks. This is not a time to cut corners and to use equipment that is not, has not been found to really be effective. And so we need every medical professional wearing their PPE, which is appropriate for the need every time with no exceptions. That's what we need.
I mean, it's the epitome of being on an airplane and them instructing, put your own mask on, take care of yourself so that you can help other people. You're of no use if you're sick or not able to help.
And this is why it's so important for the community to recognize that, it's not, it is about the safety of the medical professional, which has to be first, so that they are there, so that they can care for all the people that we are there to care for. So truly, it's in everyone's best interest to ensure that we are helping our communities in this way.
Dr. Mary, what are you seeing with physicians here in Central Florida? Because we see the hotspot of Connecticut, New Jersey, New York. What is the condition physically and emotionally of our EMTs, our medical staff, our physicians here?
Yeah, well, to be honest, Suzanne, I've been in clinical medicine for 25 years. I have not seen physicians, nurses scared until now. On a national scale. I'm involved, like I've said, with many physician organizations. I am now also involved in a variety of groups specifically that are physicians looking and educating each other, informing each other about this virus in particular, the coronavirus. And people are, this is different. This is not like anything that we have experienced before. And the reality is that, there have been infections that have come around, but the difference is that there's not been a pandemic like this one with the potential to be so destructive and takes as many lives since 1918 when we had the flu pandemic. And so, there's no one alive who has handled something like this. And so we need to remember that that's part of why, the preparation hasn't been there. I think there's many reasons for why some communities are not ready, but in particular, we do have to remember that this is the first time all of us have dealt with something like this. And so it calls for great patience. It also calls for wisdom in terms of, every task force, everybody who's making decisions, both at the state, local, and national level, have to be experts. And so those who are running the show, like, whether it's a hospital leader or government, they must listen to the experts, experts in infection control, in epidemiology, people who have handled things like this before. And so that is what I don't see happening all the time.
Dr. Mary, I'm not going to ask you to predict the future, but generally speaking, what is the general consensus of the wave of this for Central Florida? Are we going into a more serious position for the next 14 days and then coming on the other side, like based on other countries? Where do we stand?
It's going to be longer than 14 days. No doubt about it. I think we need to be thinking, that for the foreseeable future, certainly for the next few months, our lives will continue to be disrupted, but it is worth it in the sense that the more we continue to socially distance and to truly follow the guidelines that have been given in the various states and communities, it is essential because that will buy time for every hospital, clinic, every medical setting to be ready for this. This came so fast. And so if we don't even have the PPE that we need to protect our staff, we have already started behind in a very critical area. And so the more we stay away, the more we do what's called flatten the curve, which I think we have heard a lot about. And so what we don't want is that peak that we are behind before we even get going. So we want to flatten the curve of the speed of spread so that we have a bit more time to get the equipment that's needed to continue the flow of information, which has been slow at the beginning as well. It's improving. And to be honest, what I see happening is physician groups coming together and educating each other. I just today found an app that actually was created by a physician gathering information from all over the country, different studies, because we want to make decisions, again, based on science, based on evidence, not just anecdotes, which is, basically stories and not science. So it's important to come together as well.
The timing is amazing because you have written a book, your most recent book. Would you talk about that?
Sure. So my latest book is Recapturing Joy in Medicine, and it is actually a coaching manual for physicians to live well and lead effectively. And a lot of what I talk about, it is about a lot about personal wellness and professional development, but the main theme has to do with the patient-physician relationship, returning back to the center of everything we do. But also it is a call for physicians in particular to speak up and to regain their position of influence, to regain the ability to, be the leaders in medicine that we are. And so many physicians, just today, Suzanne, I found out that there's an ER physician in California who was fired because of speaking up in his hospital after 17 years of working there. He's been fired for speaking up about safety issues, about this very issue with personal protective equipment. How can a physician doing the right thing, protecting himself, his team, and patients, be fired for something like that? It is, I just can't even believe it. So the American College of Emergency Physicians came out with a very strong statement. And I'm telling you, every medical organization needs to have our backs and needs to speak up, needs to be all about protecting us so that we can care for our patients. So essentially protecting us means protecting you, me, my family, your family, and all of us. And it is simply unbelievable that something like that could happen. And unfortunately, it will happen in some settings, and it's worth the risk. I think we need to speak up. I think we need to take the reins, and at a time like this, we just can't mess around.
I mean, before COVID-19, you were all about bringing joy back to physicians and, for burnout, helping them to regain that love and vitality that they had that made them want to get into the medical field in the first place. And now more than ever, I mean, doctors working around the clock, not enough tools. It seems like so many things are built against them.
Right. So it is a time truly to begin with the basics. And so for physicians, my message is really the same that it's been. So we do need to make sure that we're taking care of ourselves, that we're getting enough sleep, that our work shifts are not unreasonable during this time, that there's enough help. We need to make sure that we're eating, that we are drinking enough water, that we're stopping to use the restroom. Now we're wearing PPE, and, even going to the restroom becomes a major ordeal. So all those things are just basic, but here's the issue with doctors. So we're starting this pandemic already burned out. I mean, 40 to 60% in most, that seems to be the average for most specialties of physicians, basically burned out. And so that's how we're starting this pandemic. And so it is a time to, and the reason that, the number one predictor of burnout for my profession is our inability, whether real or perceived, to do our jobs well. And so that needs to be first, as it always is. And so if we're able to do a great job with this situation, we're going to feel good about ourselves, and we're going to, continue to come to work, because physicians, risk, that risk is part of our profession, right? But if we show up and nobody's listening to us, and we have non-experts making decisions that will affect our safety and our patient's safety, enough is enough. We must speak up, and the time is now.
For those of us that are quarantining and social distancing, how can we support the physicians and the people in the medical field that are around us?
Right. And I thank you for your question. So again, it is National Physicians Day, and it is a day to celebrate those people who sacrifice to care for us. And so, a simple thank you goes a long way. I mean, I mentioned a phone call regarding PPE, but also, a phone call to say thank you. I recently had the opportunity, when a family member was ill, after they were cared for very, very well in a different state, I wrote a letter and I sent a gift in the mail, because I know that most doctors don't get that. Most of us, don't necessarily. And, the other thing I do for doctors is I encourage them, when you do get a thank you, embrace it, drink it in, because it really does help us to know that we're appreciated. And so that's important. And whatever ways that we can find to express gratitude, and also to nurses and to, just everyone out there now caring for patients, and really going to work each day scared, to be honest. So expressing gratitude is
It's a
healing.
great idea.
Helpful.
It's not just the physicians. I'm thinking about the families, all the hours away now. Of course, they always put in a lot of hours, but more than ever now, they are just torn away from their families. So, while we're thinking about the physicians and everyone in the medical field, I think about their families and children too.
Yeah. Yeah. And, if you could see some of the little videos I've seen of doctors getting home right now. I mean, so when we get home after seeing patients, right? Many of us will try to change clothes even before we leave the hospital, and then we come home, and many will have like a whole pattern. Leave the clothes in the garage, leave the shoes there, wash your hands, take everything off, go shower, and then go say hi to your family. And so it's a very strange thing imagine for little kids, that whole thing. But families will get used to it. And but it is important for us, I know, that to have a system of transition as we come home, not only for infection control, but also just mentally, emotionally, spiritually, as we transition from a very, very stressful time right now at work to being home with our families. And so those who have spouses, it would be good for the spouse to understand that they may need just a little bit of downtime. They may need just a little time, space to just be with their thoughts and just kind of gather themselves before kind of reintegrating into family life. And so again, it just will take patience. It'll take some planning. And then with the children, the same, trying to explain what's happening in an age-appropriate way so that it doesn't cause excessive anxiety and stress, but it puts things in context so that they're not scared unnecessarily, and so that they can understand. And then, coming up with new routines will be helpful too. So all those things I think will help.
Dr. Mary, before I let you go, what is a final word of encouragement that you could give to physicians that are feeling very weary today?
I think, again, for me, one of the things that has helped me most, I mean, I have my own story of burning out. And so one of the things that helped me most was to become actively engaged in finding solutions and speaking up for what we know is right. And so that really empowered me. When others were not empowering me, I found that my own proactive nature helped empower me. And so I would say to my colleagues to recognize that you are the leader of the medical team, that you are the expert in medicine, and that if you have people telling you not, for example, to wear equipment that is not adequate, say no and make it happen so that you can get what you need and your team needs as well. And that's one example. I think we do need to speak up. I think it's important to focus on the basics and ensure that you don't feel selfish by having your needs met. And so everything from, like I mentioned before, from not working on reasonable numbers of shifts and hours, to getting enough sleep, to being outdoors, to finding time for yourself in the midst of all these, and then staying connected with colleagues who can not only give you information but encouragement. One of the things I'm doing is starting just a simple Zoom call where I can support my colleagues and just find ways to give them space where they can vent, when they can share their fears, their anxieties, which are real, and also foster a team and foster camaraderie, which we all need right now. And I think they can also do that at work, so to the extent that everybody's working as a team, I think it will be so much easier. What we don't want to do is to isolate. And so I would very much counsel against that. And so let's just stay together, reach out for one another, and also pay attention to the people around us so that we can, again, today I help you, tomorrow you help me. It really works well when it's like that. I also would urge hospital leaders to be listening to their physicians and their nurse leaders as well in the hospitals, so that they're part of decision making right now. It really is critical to feel that you're valued, that you're respected, and that you're listened to. not just sent to the front lines to do the tough things. So we really do need to be a part of all that.
Well, let me just not let you go before I say thank you for everything that you're doing. And I know that the Florida legislature and Senate and government is really counting on you. They're in direct contact with you, and you're making some important decisions. And thank you so much for everything, the whole scope that you're doing. And just one more time, let us know where we can get your book.
My book, well, my website is www.faithfulmd.com, MD for medical doctor, faithfulmd.com. It is available at Barnes & Noble stores. It's available on Barnes & Noble online and on Amazon as well.
Okay, and one more time, the name of it is?
Recapturing Joy in Medicine.
Recapturing Joy in Medicine. Dr. Mary, thank you so much. And maybe we'll do a follow-up. Thank you for everything.
That sounds great. Thank you, Suzanne.
Have a great day.
Thanks for watching the show. We hope that you enjoyed it. Having digital marketing for your product or organization is so crucial these days. People are ditching traditional advertising like print and broadcast commercials and turning to relationship marketing platforms like YouTube and podcasts that people can consume on demand on their time. Let's talk about how we can build your digital library with segments just like this.